Hi everyone, how are you? It is Dr. Splickle, functional podiatrist and human movement specialist. I'm here to speak to you about swelling. So why are the feet swelling? Why after I sprain my ankle do I immediately get this swelling? Or if you've had surgery, specifically foot surgery, why is there so much swelling that is happening in the foot and the ankle? So let's talk first about the swelling that has to do after an ankle sprain or after surgery. Now, these two types of an acute swelling that is present in the foot and the ankle is primarily associated with an injury response. So obviously we identify that an ankle sprain is considered an injury, but surgery, even a minor surgery, is considered by the body as an injury. And when we detect an injury, the body has a response, an initial inflammatory response that creates vasodilation, and we start to get this opening up of our circulatory system to try to get the growth factors and the nutrients and the oxygen and everything that we need to the tissue to start the repair process. This is actually considered part of an immune response. So if you ever hear about this inflammation immune response and how they dance together, is because inflammation is not just an important part of a acute injury, I sprained my ankle, but it's also an important part of a infectious response. So that first initial response by the body is very similar in both of those. So you will hear or read a lot about the management of inflammation is actually a response of managing the immune response. And we saw this with COVID, is that when people have a really strong immune response, then we saw this rapid cytokine storm or too much inflammation. So that kind of dance between inflammation and immune is something that I want you to appreciate, okay? Now let's go back to the foot and the ankle. After surgery, after you sprain your ankle, both of those are perceived as an acute injury. We get this acute inflammatory response to get all of the growth factors and the nutrients and start the process of healing and protecting the body and the tissue. Now, what we typically want to see is that there is a fine regulation of that immune/inflammatory response, which means after it hits a certain point that all of the cytokines that should be there and the growth factors and all the immune responses that we need in the area, once they're there, we want to stop that vasodilation response. What often happens though is that we get kind of stuck and it persists, and then we get too much swelling in the area. So part of vasodilation is actually what's considered a capillary permeability. Now when your capillaries become permeable, almost like how your gut can become permeable, right? And things pass, so your blood-brain barrier can become permeable, then things start to cross, okay? There's these junctions that allow things to cross these barriers. Now in the capillaries, what happens when you have too much or persistent capillary permeability is you get a leak, capillary leak, and then this swelling shifts into what's called a third space. So that third space would be extracellular fluid. If you're like, Dr. Emily, what are you talking about, right? That's where we say, how do I get all that swelling that is outside? And if I push in it, if you push down, it'll actually pit. It's called pitting edema, which means you're pushing that extra fluid that is in the third space is now this specific type of swelling. So when we're trying to control that, let's say right after an ankle sprain or right after surgery, you are trying to control the inflammatory response and you're also trying to control this capillary permeability. Now, the way that you can do that is by using something that is going to mitigate or cut off that inflammatory response. Now, one way is people ice, right? Now, the way that ice, I don't want you to think of ice as anti-inflammatory because that's not using ice in the right way. Ice is a vasoconstrictor. So when someone says RICE, right? Rest, ice, compression, elevation, what they're essentially saying is that they are trying to mitigate the vasodilation and the capillary permeability, not through an inflammatory response. We're not saying that ice is anti-inflammatory. We're saying it has a vasoconstrictive response within the body when you're icing. Okay, so you could do that. You could do that. It works really well, right? You could also use anti-inflammatories, right? If they're used right away. So typically after surgery, you can give an anti-inflammatory intra-op or immediately as the patient is in the post-operative space. This is where compressive dressings come into place, is that when I used to do foot surgery, is we would wrap the foot in a compressive bandage, and we are essentially limiting the space. We're restricting that third space so that the fluid does not have that opportunity to go into it. Now, the worst thing that you can do is that if you sprain your ankle, or let's say you did have surgery done and the bandage was loose, or you didn't wrap your bandage and you are keeping your foot in a dependent position, which means below your heart is dependent. Now what happens is you've opened up the opportunity to shift into that third space. So your swelling is going to happen much easier after an injury and you stay in that dependent position and you do not have a compressive bandage on. If you then say, oh my gosh, I sprained my ankle and my ankle is like a balloon. It just boop, it just completely expanded. You're like, oh my gosh, I can't even see my ankle bones. And then you try to do an ACE bandage and a compressive dressing. Completely different. What you want to do is sprain your ankle, wrap it right away. Boom, get on it, ice it, control that vasodilation and limit that third space opportunity. To try to compress and get that fluid back out of that third space takes a little bit longer. It takes time. So that's the way that you want to be thinking about this, is we want to be anticipating that third space shift versus reacting to that third space shift. Now, another way that you can control this, and I recently wrote a blog for Step Strong about it, which is you can use different supplements. So serrapeptase is a systemic enzyme that has been shown to reduce capillary permeability. And there's some really interesting research studies that are demonstrating the efficacy of using serrapeptase immediately post-op, and it controls this post-op swelling much more effectively than a control, meaning no supplement or anything that is given, and then also compared to NSAIDs. And that is really promising to how you can recommend, or for patients to control that post-op swelling, because the post-op swelling is something that can affect healing time. It can affect pain. So oftentimes individuals, ankle sprain, post-surgery, foot injury, all of these, the more swelling, the higher the pain. The more swelling, the slower the recovery. So thinking about immediate post-injury or post-op swelling, you gotta get on it right away. So again, to summarize, that's gonna be serrapeptase. Check it out. Go to stepstrong.com and learn more about these supplements. Really, really beneficial. I recommend to my patients. Do icing immediately, but understand that icing is to mitigate the vasodilation response. It is a vasoconstrictor. We're not looking at it as a quote unquote anti-inflammatory. We're doing something compressive immediately, not reactive, not after we've already had the swelling. You're doing it before that swelling or that fluid gets into the third space. Okay, and then you of course got to keep your foot elevated. You can't be in a dependent position, then everything comes flowing down and it's hard to get that back up. Now, let's say maybe you had an ankle sprain and you didn't do what I said because you didn't hear this video, and now you have this persistent swelling that is occurring. What can you do? This is where you want to look at making sure that you are activating your pump, your calf pump. So your calf is a second heart, is the way that you can think about it. And with every step we take, we get this pump moving. It is helping to get that extracellular fluid back up to our heart to go through the lymphatic system, and then we clear it out. Okay, you want to make sure you're using something that's compressive. Now, it's not going to be compressive in the same way that a bandage is before you have the swelling, but this is where you could have a graduated compression stocking. There's many now on the market, so a graduated compressive. It's helping to milk the fluid back up to the heart. Another way that I like to do this is through a product called Revitive. And Revitive is a neuromuscular electrical stimulation, so NMES, and it's a little device that you put your feet on, and it sends a signal through to then get the muscles of the feet engaging, and it has a rocker to get the pump of your calf engaging. So revitive.com, I will tag them in here as well, is a great way to mimic the pump to get the fluid back up through the circulatory system, and it's great at preventing DVTs, which is very important. So that's another way. Third way, or an additional way, is going to be getting into your lymphatic system. Are you doing lymphatic massages? Are you doing dry brushing? So really support and favor the lymphatic system so it can help to clear that extracellular fluid and that third space. Okay, being very patient. Now, after foot surgery, you can have persistent swelling after a foot and ankle injury, surgery, ankle sprain, whatever type of other injury it might be. Liz Frank, name it, it's in the foot and the ankle. It can take up to 6 to 9 months for swelling to persist within the foot and the ankle after an injury. So understand also that that's a normal process, and a lot of that has to do, again, because of the dependent position. Okay, so if you are looking to learn more specifically about any of these products that I've mentioned, please visit stepstrong.com to learn more about systemic enzymes and the power of serrapeptase. Visit revitive.com to learn more about neuromuscular electrical stimulation and how that can support the return of the circulation and the fluid back up to the heart and mimic that pump, that calf pump. And then please do stay tuned because we have some compression socks coming soon from Naboso. Please make sure that you do follow me on Instagram, dremilydpm. Please visit dremilyspiegel.com to learn more, and I do in-person and virtual consultations as well. Stay barefoot strong, stay amazing.